How to stop snoring, 5 tested and proven tips. Unfortunately, there is no single way to stop snoring and therefore no universal answer to the question, how to stop snoring. Snoring may have several causes and there are quite different solutions to address them. We will show you 5 medically proven snoring remedies against your snoring issue, with which you can prevent snoring. How to stop snoring. Tip 1. Improve nasal breathing. Impaired nasal breathing is rarely the only reason for snoring. More often snoring occurs in the rear throat area, solution, snoring mouthpieces, or in the transient area between the oral and pharyngeal cavity, solution, snoring mouth guards. Nevertheless, impaired nasal breathing is one of the major snoring triggers. Simply put, you won't be able to stop snoring when your nose is congested. How to stop snoring? One possible way might be through the use of a nasal dilator, also called a nose vent or snoring clip. This snoring aid improves nasal breathing and, in turn, stops nasal snoring. It consists of 2 small, soft plastic arches or tubules that are connected through a bridge. The form varies depending on the manufacturer. Every arch or tubule is gently pushed in a nostril. This expands and stabilizes the nasal entrance and the adjoining anterior part of the nasal cavity. The nasal passages cannot collapse or contract, even during strong inhalation. You start to breathe freely. In medical terms, the process of opening or widening is called dilation, which is why the snoring aids described are also sold under the term nasal dilators. How to stop snoring. Tip 2. Avoid mouth breathing. The most common cause for snoring is breathing through the mouth while you're asleep. But mouth breathing not only triggers snoring, it is also rather unhealthy in comparison to nasal breathing. This makes it all the more important to do something against this kind of snoring. Use a snoring mouth guard for mouth snoring. The most effective way to tackle mouth snoring is the use of an snoring mouth guard, also called a mouth shield. It prevents mouth breathing during sleep and allows your body to switch to the more restorative nasal breathing. The mouth shield is a dental mouthpiece whose form closely resembles a boxer's gum shield. It is placed between the lips and teeth and gently anchored to the dentature of the upper jaw. The mouth guard has a very slim design and a comfortable fit. It is large enough that it cannot be accidentally swallowed during sleep, so there is no risk of choking. How to stop snoring. Tip 3. Sleep on the side. The second most common cause of snoring is the tongue relaxing, falling back into the throat and constricting or blocking the airways while asleep. So what can you do against this type of snoring? Because this problem only occurs when sleeping on the back, there is an easy fix to it. Try sleeping on the side, ideal, or consider sleeping in a prone position. Positional therapy position trainers can facilitate the transition from sleeping on your back to sleeping on the side. Position trainers can help you to sleep on the side. Positional therapy encompasses all products that help you to sleep in a lateral or prone position. These are primarily anti-snore backpacks, positional sleep belts and bandages. A foam wedge or an air cushion is integrated in the rear part of these anti-snore backpacks and positional sleep belts, which renders it impossible to sleep comfortably in a supine position. For sleeping comfort, it is important that the foam wedge's contact area on the back is relatively small, so that you don't sweat during sleep. Because wherever the foam material comes into direct contact with the skin or the pajama fabric, the air can barely circulate. How to stop snoring. Tip 4. Adjust your jaw position. A relaxed tongue is the second most common reason for snoring. When the tongue falls back into the throat, while sleeping on the back, this causes tongue snoring. In this case, moving the lower slightly forward can fix the problem. This mandibular advancement can be achieved with a mandibular advancement device, MAD, also called a snoring mouthpiece. Roughly speaking, snoring mouthpieces are broadly divided into 2 groups, monoblock mouthpieces and biblotes mouthpieces. Monoblocks consist of a single piece that can be custom molded by making an impression of your teeth. Monoblocks are rigid, i.e. once fitted, the mandibular advancement cannot be calibrated and they do not allow for lateral jaw movements. Biblocks consist of 2 separate pieces, one for each the upper jaw and the mandible. Each piece can be custom molded by making an impression of your teeth and jawbone. The 2 pieces are connected with each other after the fitting is done, for instance, with flexible plastic bands. Biblocks allow for lateral movements which increases the wearing comfort significantly. How to stop snoring. Tip 5. Exercise your palatal tissue. Every form of snoring is also always accompanied by a tissue weakness. Relaxed tissue in the oral or pharyngeal cavity starts to vibrate when inhaled breathing air rushes over it. Of course, this is more likely to happen when the tissue is loose or unexercised, rather than toned. If you specifically promote muscle tone and tissue firmness, you can effectively reduce or completely stop the occurrence of snoring. There are a number of different kinds of exercise equipment and exercises. Various exercise equipment for different forms of snoring. How to stop snoring. When it originates from the transition area between the oral cavity and the throat region, so-called mouth snoring, you should consider primarily strengthening the muscles around the lips and the mouth area. A near choice for that purpose would be the use of the face former method. With the face former, a tongue retention sleep aid, you can exercise and condition the muscles in the mouth region in such a way that you keep your mouth closed during the night. Moreover, with this device you exercise the musculature in the oral cavity and reduce the amount of loose tissue. If snoring occurs because your tongue falls back into the throat, the dragon pearl method may be the best choice of exercise. With this auxiliary means you can strengthen the tongue base and firm the tonsillar ring. The tongue's musculature is unable to relax to the extent that it would fall back into the respiratory tract and block or constrict the supply of air in the throat area. This is how snoring can be prevented. Both exercise methods require patience and discipline to produce promising results. If you like this video, click the like button and click subscribe.